Hello, everybody, and welcome to our Connect with the Myeloma Crowd Chapter. My name is Audrey Burton-Bethke, and I am the Myeloma Community Manager. And I really thank you for taking the time out of your day to spend with us. Today's program that we're featuring in the Connect with the Myeloma Crowd Chapter is HealthTree Cure Hub. And we are going to be talking about the newest feature of HealthTree Cure Hub called Patient Solutions. Today's event will be recorded and will be sent out to all registrants 24 to 48 hours after the event's completion. I'll begin by thanking our sponsors, without whom this event would not be possible: AbbVie, Bristol Myers Squibb, Amgen Oncology, Genentech, Karyopharm Therapeutics, Oncopeptides, Adaptive Biotechnologies, and Takeda Oncology. Our special guests here today are Todd Foster, Product Manager at the HealthTree Foundation, Anna Sahun, Head of the Patient Experience Team, and Patricia Flores, Data Validation Agent. I will introduce them and then turn the time over to them for the feature. Todd Foster is the Head of Product at HealthTree, and he is an IT healthcare executive who specializes in patient experience and clinical process improvements. Todd was Director of Patient and Provider Experience at MD Anderson for over a decade. Prior experience includes leadership of IT development projects at Intermountain Healthcare and United Healthcare. Todd has a passion for using technology that can help patients have a better life and along the way help to further research for a cure. Anna Sahun is an engineer and psychotherapist. She has experience in both fields and loves them equally. She leads the patient experience team at HealthTree, and she is passionate about talking to patients and empowering them. Whenever she's not working, you'll find her exploring the world, eating different kinds of food, hiking, or skiing. And Anna is actually joining us from Mexico today, so that's exciting. Patricia Flores is also joining us from Mexico, and she is an international medical graduate who joined HealthTree in 2020 as part of the patient experience team. She helps patients understand and track their lab and genetic results, as well as relevant information from their health history. She loves ballet, traveling, and reading a good science fiction book as often as possible. So as I mentioned earlier, today's topic is discovering patient solutions, and patient solutions is amazing. So Todd will be demoing the feature. And to give you a little bit more background, I'm sure Todd will, but Patient Solutions is a tool that collects different side effects from patients and then shows the solutions that other patients have tried to solve that side effect. Other patients can then vote on the side effect solution and report whether it has worked well, it had no impact, or whether it made them feel worse. At the end of the demo by Todd, Anna and Patricia, along with Todd, will help answer any questions that you might have. Please keep in mind when asking your questions that we cannot provide medical advice. That needs to come from your treating physician or your treating medical team. Todd, the time is now yours.
All right. Thank you, Audrey. It's great to be here with all of you and introduce our patient solutions tool to you all. We spent a lot of time working on it. How it came about, just to give you a little bit of background, spent hundreds of hours speaking with hundreds of patients, asking, what do you need? What would help you the most as you go through your treatments, and side effects always is at the top of the list. Almost every patient we talk to. If you look in the Facebook groups, probably 80% of the discussions going on in the Facebook groups are related to side effects. And so we started talking about it and going, we need to provide some sort of solution to patients for side effects, something to help them. And the Facebook groups are great, but it's hard to keep track of your information and who's commenting on what and things like that, and hard to find things later that you might want to find that you remember reading once. So we started working on this last July, I believe, of 2020. And we worked on it. We had something. We thought this is awesome, and we tested it with a few patients and realized we had more work to do. It wasn't complete. It wasn't giving the information of what patients were looking for. So we actually did that a couple times, went back to the drawing board and came up with, again, something that we thought was great, and took it to a couple patients or a handful of patients are like, well, I need this, I need that. And we went back to the drawing board again. So anyway, here we are finally in March, Myeloma Awareness Month, and we turned it on last night. So Patient Solutions is available for anyone with a HealthTree Cure Hub account. And we're very, very excited about it. So I am going to share my screen. Let me get all this out. Okay. First off, hopefully you can see my screen. I need to minimize my window. It's covering up. There we go. Okay. Hopefully you can all see the screen. Before we go into the patient solutions, I want to talk a little bit about treatment history. In HealthTree Cure Hub, there's a place for you to put all of your information. You can have everything in one place. When I was working at MD Anderson, the average patient there saw 3 different doctors. And so all their information was scattered in all different places. And HealthTree is a place where you can put all of your information. One of those things that you can put in it is your treatment history. So this is just a demo patient account that we have. And, you can put in your dates and what treatment you had and the outcome, did it work or not? And then your side effects. What side effects did you have and how bad were they? Severely disrupted life, blood pressure, muscle cramps, it was a disruption, but not severely, and uncomfortable or hardly noticed the side effect, but it was there. And so in this patient, we've got lots of different side effects that have been entered based on the different treatments this patient has had. So when you go into patient solutions, it's over here on the left-hand navigation underneath treatment options. If you click on that, it will take you to this main patient solutions page. And you'll see this tile up here. You have treatments with side effects in your profile. Please tell us what you have tried to reduce your side effects. So this is an easy way for you to enter your side effects for everything that you have listed in your treatment history section of HealthTree. So if you click on this button, yes, I want to report my solutions. There it goes. So you can see that this patient, the side effects they've reported, there have been 16 side effects reported, and this is the first of the 16. It was an infection of the upper respiratory. And it said, what solutions did you try for your infection? And it'll list the things that we have right now listed in the database. So maybe we'll say an antiviral drug. It did not help. I reduced my medication, it helped. You can select any or all, or you can say I tried something else, not listed here, and that it helped. And then we ask you what that solution is. And you can just enter, whatever the solution was that you tried that we don't already have in our list. If you'd like to make some notes, you can, you don't have to. When you save that, it adds that to the database. And now you can see you're on your second solution of the 16, which is low platelets. And you can go through that process for every one of your 16 side effects you've reported so that you can tell us what your experiences were with those side effects. So I'm not going to go through all 16 of those. This button will stay at the top of your screen until you've answered all the side effects. Once you've answered all the side effects, it'll go away. The button won't be there anymore, and it will tell you great work. You've entered your solutions to all the side effects that you have listed. I don't know if my internet is slow. Anyway, it should be loading this page a little quicker than that. While that's loading, just as a point of reference, right now we have 114 side effects listed in this tool with 1,264 solutions that have been provided by patients. So it's important to note that this tool is, sorry, I'm going to back it out. I don't know why it's taking so long. Sorry about this, everybody. Um, so anyway, it's important to note that all these side effect solutions have been reported by patients. So this is a crowdsourced tool. It's not provided necessarily by anyone with a medical background. It's provided by patients. Let's see if we can get that to load now for us. So keep that in mind as you're using this tool, and keep in mind, as Audrey said, that if you see something here that's interesting that you would like to try, some of these things you should probably run past your medical team and get their advice on that. Maybe on the dose and the frequency of the dose, if it's something, over the counter or herbal or something like that. Always check with your medical team and make sure that they know that you are going to try whatever solution for your side effects. So here's the screen. Here's all 114 side effects. It's a great big list of side effects. You can just search on a specific side effect, and we will do that in a little bit. Or you can click on this drug filter, and you can find a drug that you would like to see what the side effects are associated with that drug. So a popular one with everybody's probably Revlimid. You can click on Revlimid and save that. You can see that, there's quite a few side effects associated with Revlimid. You can see here that it says it's found in 56% of the patients in our database have experienced fatigue or tiredness with Revlimid. And the average severity level they put is a 3. Neuropathy is the second most popular, with 39% experiencing neuropathy with Revlimid and an average severity level of a 3. So if we say we want to look, you're experiencing neuropathy, so you want to look at the solutions, we can click on that tile and it will hopefully open up a screen quickly. There we go. And there have been 75 solutions for neuropathy reported. And you can read these. So the most popular one is exercise to help maintain a good blood flow to the hands and feet. 87 patients have reported trying this as a solution for neuropathy. And you can see over here, 85% said it was successful, that it did help their neuropathy. 15% said they noticed no change, and 0% reported feeling worse, which is a good thing. So say, you're a patient, you're in Patient Solutions, and you've tried exercise. You can click on this, I've tried this solution. We're going to ask you if you know which drug caused this solution. You can say yes or no. When you go next, we'll just ask, did it help or did it not help? And then you submit, and then your answer will be included in these answers here for other patients to review. There's Gabapentin, that's the second most popular, with 83 patients reporting that, with a 58% success, 39% no change, and 4% saying they actually felt worse on Gabapentin. So you can scroll through all these side effects that patients have reported. And if you've tried them, let us know. It just helps everybody else. The more patients that say they've tried these solutions and if they worked or not, it helps everyone in the community. And like I said, there's a big long list of all different kinds of things. You can sort, right now it defaults to sort by most common. You can sort them in alphabetical order if you'd like, or the most successful. So whichever reported the highest success level here, it will be sorted in that order. I'm going to put back to most common. Now, I know there was a question. I saw a question in the chat that came up. I think Glenn asked about neuropathy and synexis, I believe is how you say that, if that has been something that has worked for people. That doesn't happen to be one of the solutions that we have in our list. But at the bottom of every list of solutions, we have our forums. And the forums are just a free space where people can just go talk with each other, put whatever you ask questions, put your experiences. And if we scroll down, I believe it was Angela, she made a comment in the forums that synexis therapy works. So you can read what Angela had to say about that. She started Synexus therapy in March of 2020. And by August, her pain level was down to a 2 or 3, and she was able to do a 6-mile walk and a bunch of other activities. So for her, Synexus is something that worked, but it's not in our list. So if you see something that you've tried, or if you've tried something that you don't see in our list of solutions, you can tell us about it. Add a new solution not listed below. So if you click on that, we can enter the solution, Synexus, and tell us if it helped or not. And then when you submit that, it won't immediately become available in this list. We have to go in and look at it and approve it. And once we get in and approve it, then Synexus will be an option here in the list of solutions for neuropathy. So, and again, you can click here to get down to the forums real quickly if you want, instead of scrolling. Some of the solution lists are long. But feel free to come down here if you're looking at solutions and feel like there's something you want to share with the community. Come down to the forums and click add a post, and you can write whatever you want to write about neuropathy for other patients to learn from, or you can ask questions and hopefully other patients will answer them. Yeah, like you can see here, this patient has replied. Doug replied to Jenna's comment that she had. So trying to provide as much help as possible for you around solutions. I'm going to go back to the main page and hope that it loads. So again, we have some sorting here. You can sort by most common, which would be found in the highest percentage of patients. You can sort alphabetically, or you can sort by severity, which would be, the most severe side effects will show up at the top of the list for Revlimid in this case. You can also, say your doctor wants you to start RVD, Revlimid, Velcade, and Dex, and you're wondering, well, what can I expect if I start this triple combination of treatment therapy? So you can select those 3 drugs and you'll see what patients have reported as side effects on those 3 drugs. And again, you can see the percentage. Fatigue is the most commonly reported side effect in HealthTree Cure Hub right now. Neuropathy happens to be second most commonly reported side effect. So you can see the percentage of patients and the severity level again by selecting any of these drug combinations. You can deselect them all and close out, and then you just get back to the main list of all the side effects. So like if I mentioned fatigue was the most commonly reported one, we have 29 solutions for fatigue. Rest when needed. I guess that makes sense for fatigue. 89 patients have reviewed that and 94% said it worked. And that one obviously makes sense. Start an exercise routine. 74 patients reported that and 92% said it worked. Take your medications at bedtime instead of in the morning or afternoon. 49 patients reviewed that and 67% of them said it did work. 27% said it did not, and 6% said it made them feel worse. So again, these are things you can take into consideration for yourself to try to, see if it will help ease some of the side effects you're experiencing, in this case with fatigue. I did also, you can sort too based on the type of solution. Is it a beverage and food solution? Is it investigational? Is it over-the-counter meds? For fatigue, there is no over-the-counter meds. Physician intervention, reduce your medication and chemo dose is the only physician intervention related to fatigue. Prescriptions, antidepressants or Ritalin has been reported. So you can sort, you can, narrow down your list of things based on these predefined filters based on what you find most interesting. Would you rather address fatigue with beverages and food versus a prescription? Maybe so. So there are two solutions related to beverage and food, or you can go back to all of them. So that we've tried to make it as easy as possible for you to find the data and information that you're looking for your exact situation. And like I said, we can't stress enough that this is a community, a crowdsourced based tool. So it is patients that are entering this information, and we would be so excited if all of you could go into your HealthTree Cure Hub accounts and tell us about your experiences related to side effects. The higher the numbers we have in here, and the higher what the percentages are, will help people make decisions or help them decide, I want to try this solution over another solution based on what other patients are experiencing and saying in here. Okay, so that is basically how the tool works. It's not too complicated, hopefully. Just again, a quick review that you can quickly answer all the solutions you've entered in your treatment history. Whatever you've got in there, you can quickly answer them by clicking on this button. If you have answered them all, this whole tile goes away, so you'll know that you've answered them all. And then if you say anxiety popped up recently and you want to look at that and say you've tried any of these, we'd ask you to click on I've tried this solution, so that, like I said, you can help other people in their journey with what your experiences were.
Todd, for those that might be new to HealthTree Cure Hub, will you mind showing them how to add a side effect to their treatment on that treatment history section?
Absolutely. Yeah, so real quick, I mean, those of you that are new to Cure Hub, there is some information we'd like to gather from you because it helps the rest of the Cure Hub system work. But there's a diagnosis page where you can put in your diagnosis and where. We give you some information about your risk value if you've entered that or had that. You can tell us about your team, who your medical team is, and if you have any caregivers that are helping you, and if you have a coach that's helping you. We also ask a few questions about health and fitness. That helps us to present you with treatment options that are personalized just for you. We get rid of all of the treatments that you can't have for one reason or another, so you don't have to spend time worrying about them or looking or learning about them. And then, yes, in treatment history. So if you already have a treatment entered, like let's go down somewhere, radiation, there was no side effects for radiation. If you click on edit, it brings up our list of side effects, the 114 different side effects that we have in the system. And they're all broken out. You can pick any of these, and they work similar. If you click on fatigue, we ask you again, was this hardly noticeable? Was it uncomfortable but manageable? Was it disruptive to your life? Was it severely disruptive? Or was it unmanageable and you had to stop the treatment? And you can select whichever one it is. You can select as many as you want. Hardly noticeable. You can just go through this list and do whatever you'd like. And once you've entered all the side effects you experienced, you save that. And now under radiation, we can see the 3 side effects that I entered just now for the radiation. And again, if you're entering a treatment, it takes you through a process, but at the end of entering a treatment here, it'll ask you what the side effects were as a part of that adding your treatment process. But if you forget or just decide you want to come back to it later, you can always click on the edit button here and add in those side effects. Or even say that, this patient's on Pomalyst and a new side effect popped up, you can click on edit and, pick whatever new side effect you're experiencing with that and keep it updated. So that's how you would add a side effect into your treatment history. Real quick, I'll just You can also enter all your labs, and the important thing to know, a lot of this information is, it can be difficult and time consuming to enter your information, and we have people here that are able to help you with that. Just call our support line or email us at support@healthtree.org, and we would be happy to help you get your information into the system. These are the labs. You can see your myeloma markers, and what your lab work is doing based on your treatments. There's a lot of treatments up here that this patient has had. We do the comprehensive metabolic panel, the CBC, and then there's also a spreadsheet view of all your labs. And so again, a lot of this we can help you enter that in. We have an imaging page where you can put information about your imaging. We haven't added one yet for this patient. If you've had genetic testing, you can enter that information in here as well. And then we also have a full health profile. It's a lot of questions. They've all been answered for this patient. It's, I think, over 120 questions. So it is a lot of questions, but it helps tremendously with research. A lot of research is done off of some of these answers on these questions with researchers. So it's very important. So yes, that is how you enter your information into HealthTree. A really quick how-to, but mostly like what this topic was about was patient solutions.
Awesome, Todd. Thank you so much for that demo. I really appreciate that. And I mean, I already knew patient solutions before we did this, but watching it today, I'm amazed at how well your team has done, you and your team have done. This is such a simple tool to use, but it's so helpful. And this is what, patients need. So I really appreciate your time. We're going to turn the time over to questions. For those that are new to this Zoom platform, at the bottom of your screen, whether you're on a mobile or you're on a desktop or laptop computer, you should see the Q&A section, and you're able to enter your questions. I was going to say answers. You can enter, this is in Jeopardy. You can answer your questions, ask your questions, into that section, and we'll be able to answer them. And Anna and Patty will be moderating those questions. So I'll turn the time over to you guys for those questions.
Yvette has just asked a side question off patient solutions. Can you add more than one caregiver? And right now, we just allow for one, but that's definitely something we can look into if you want multiple in there.
Also, sorry. Also, something I noticed as we're waiting for questions to come in, I noticed that when you filtered the solution, you were able to see the community forums closer to the top. So for example, like if you searched anxiety and then you were looking for food and beverage things that helped them, you would see it. And then yes, as you were about to do, Todd, you're able to click the top button too. You can explain that.
Yeah. So yeah, this top button, the anxiety side effect forums, it's just a button that will easily scroll you down to the bottom of the list of solutions so that you can read what people are saying in the forum about anxiety. So it's always there. If you don't click the button, you can still just scroll down and it's there and it'll take you to that. So yeah, hopefully that helps. We wanted to try to tie the forums in with the side or the patient solutions, just because a lot of people have a lot of things to say about side effects. And so we wanted to give you a place to say those things again, so other people could read about them and see what you're saying or ask their questions that they might have and get other people's opinions on what questions they have.
Patty and Anna, do you want to moderate the questions that are coming in?
Yeah, so, well, first of all, I want to mention that Sally is reminding us that not only our HealthTree Cure Hub team can help you add all your information, but we also have our HealthTree coaches, and you can go to myelomacoach.org and request a coach if you would like to. They're great, and we have Cure Hub certified coaches that can help you add all this information also. And then we're getting the question, will updates be made to the style of graphs used in trending your test results, like an Excel line graph? So I mean, Todd,
I think that's they're
that's
referring to the
to the
lab.
labs. Yeah. Do you want to
And
answer that?
updates made to the style of graphs used in trending. So the trending labs is a lot of data too, and so it takes a while to load all that information. So the graph, it shows the trend of your M protein, you know, and you can see as you've had treatment how for this patient it's dropped and dropped some more. We haven't had any specific conversations as of yet about the style of the graphs. So I'm not sure if that answers what you're looking for. We've given you a graph so you can see the trend over time. And then we've also got a spreadsheet view of it too, that you can edit or add to if you want to add any of these. We have recently added a couple lab values, IgD and IgE for those patients, and glucose. We've had a lot of patients request that they would like to track their glucose. So anyway, I don't know if that answers the question, but this graph is intended to show you over time the results of each blood test, each marker there. And we haven't had specific, just no discussions as of yet to make any changes to how that looks right now.
Correct. And
Janice,
now,
oh, sorry, Janice, real quickly, she missed the first 2 to 3 minutes. She's just asking how to get into the patient solutions. You have to log into your HealthTree Cure Hub account. So if you have a HealthTree Cure Hub account and you sign into it, it's over here in the left-hand side underneath treatment options, and it's called Patient Solutions. And you can click on that, and that takes you to the first screen. So hopefully that answers the question there for you. Sorry, go ahead, Anna, I cut you off.
no, that's fine. I was saying that now that we were in labs, can you go back, Todd? And then we're having someone asking, is there a way to import my lab test results? There is. We use Apple Health to import your test results. And right there, if you click on upload your lab results using Apple Health, you can get the instructions. Not all the facilities use Apple Health, but you get a list of facilities. And then one other way to import your results is uploading your medical records. If you get a PDF, you can upload it there, and our team will take care of it. We'll have it ready in about 1 to 2 days, business days, and we'll email you once you have your labs there. And if you have any questions about your values or just want us to explain the reason behind or what's important and which ones have to be lower or higher, and so you can watch them, you can call us and we'll be really happy to help you, or you can just answer that email.
Well, and while we're talking about that, you can also give consent and to your medical records. We'll either request your paper medical records, and then the team will go through that and enter your lab information from there. They'll also confirm or verify everything else that's in your account to make sure it's accurate and up to date. So they'll update your treatments, your diagnosis, any of that information that is in your paper medical record. So yeah, there are 4 ways. You can give us consent and we'll get your records requested and do it for you. You can upload them using Apple Health if your facility is participating in Apple Health. You can upload a paper a PDF of your labs, and we'll enter those for you. Or you can click on Add New Labs manually, and you can add them in yourself if you want to do it that way. So there's kind of 4 ways to get your labs in there. And Mike was clarified on the graphs. He's looking for a way to order the graph in the order he wants them in. And yeah, right now that isn't a possibility. We don't have a function there to allow you to order the labs, put the 10 labs at the top that you want to track. They're just in this order for now. So that is something I've written down, and we'll add it to our list of enhancements and see what we can do on that.
Yeah, that'll be awesome. Patty, you want to go ahead?
Now, Deborah's asked, is there any reason I should still feel anxious and a little depressed? Deborah's is currently on Revlimid and on remission. So I think it's definitely worth mentioning that it could as well be a side effect from Revlimid, but it could also be related to multiple myeloma. So a lot of patients, of course, feel overwhelmed with the disease. And it is definitely something worth mentioning to your physician, because it could be something that could improve with either psychotherapy or treatment, but it should be your physician who decides whether it is something that could be treated with psychotherapy or whether it needs therapeutic management. Also, our supports group on Facebook are very useful for patients with multiple myeloma. You can speak about your experience and talk to people that have had the same experiences, but this is definitely some symptoms, both feeling anxious and depressed, something that is worth mentioning to your physician so you could have proper treatment or therapy depending on the severity.
And let me just add to that and say it's also been an incredibly crazy and stressful year. So I don't think it could be many factors that are contributing to those feelings. And you're definitely not alone in feeling that. So I echo what Patty said of going to your physician and asking for his or her advice, and also finding support where you can, whether that's through the Myeloma Coach program or through different support groups. But you're definitely not alone, and I imagine that there are many factors, maybe including side effects. And you can take a look too in our side effect forum under depression or anxiety and see if anybody else had similar, side effects to Revlimid. So just know that you're not alone and that it's been a crazy year and that you're valid in your feelings there. All right, well, we do have time for a couple more questions. I think Todd just explained it so well that there wasn't really any questions left over. So thank you, Todd, for that clear presentation.
No problem.
Oh, are you looking at?
I was just looking up Revlimid and like anxiety. There are some things in there that people have tried
Okay.
to help, reduce the anxiety level. Some of them are prescription type things. Others are, other remedies or self-management type things to try to help you
Ice
through
cream. I like that one.
I love
that.
it.
Is it?
That's
Ice cream.
my kind of side effect solution right there.
Oh, ice cream.
But then 67 reported no effect, so maybe not.
Yeah. There are lots of interesting ones. There is one, I can't remember which side effect it's tied to, but there's one that says go outside and scream at the top of your lungs. Cuddle with your animals. I don't know. There's lots of different things that people are trying, for all these side effects that you're experiencing.
Great. Well, we've talked a lot about amazing things today. And as I mentioned, this recording is going to go out in an email to all registrants. I had several people contact me and say they weren't able to make it at this time, but they wanted the recording. So we're sending that out to all registrants. And I'll also include some of the things that we talked about today, like how to contact our team if you want to import your lab results, more information about the Myeloma Coach program if you're interested, and links to Facebook groups if you want to connect with us that way. We appreciate your support, and we're excited about about the future. So we'll keep it open for a couple more minutes if there are any questions. And again, these can be HealthTree Cure Hub questions. I will say that in the future, we are going to have an entire session in this Connect with the Myeloma Crowd chapter about labs, tracking your labs, I believe. Anna, you can correct me if I'm wrong, but that will be coming later this year.
That's correct.
And that will be one that you definitely don't want to miss, because it's such an important topic. And again, I'm grateful for the feedback that we've gotten today, because it's so helpful for us to know how we can improve. We're always looking to improve. Todd, were you going to show them how to sign up?
Well, one quick thing, yeah, two things I was going to show, the signing up. But if you go to healthtree.org, you click here to create an account, or if you have an account, you click here to sign in, and that will take you in to HealthTree Cure Hub, where you can get to the patient solutions. On this landing page of healthtree.org, if you scroll underneath the Today Show, we've got a tile here that explains patient solutions and what it is. Probably within the next 2 or 3 weeks, we're going to make the patient solutions available to people that don't have a HealthTree Cure Hub account. So there will be a link here in 2 to 3 weeks that you can click on that will let you see the patient solutions, even if you don't have an account. So you can, that will be one way to get to it if you don't have an account. We don't have that available yet. We're working on it. Like we have, you can get to HealthTree University without an account, and the community forums you can get to without an account. But so that is coming. If you for some reason don't have a HealthTree Cure Hub account, you will be able to get to the tool from this landing page from healthtree.org. Otherwise, for now, you'll have to click on, if you don't have an account, you click on create an account, tell us if you're a patient or a caregiver or a different diagnosis, and then you can type in an email and an address or a password to create your account, and that will take you into HealthTree Cure Hub to see the patient solutions.
And I just want to remind everyone, for those that don't know, this is completely free. The HealthTree Cure Hub and all of our services and all of our programs are 100% free. So I get that question quite a bit, but just so you guys know that creating an account is completely free, as well as all of our services. And as Todd was saying, we want you to share this with as many people as possible when it's available outside, but also inside. Right now, if you have myeloma friends, whether they're caregivers or supporters or patients themselves, we want people in the myeloma community to know about this. So it's super exciting, and feel free to share this information with your friends. This is a great question, Todd. In solutions, can you find patients who have the same markers?
In solutions, can you find the same patients with the same myeloma markers? Is that the question?
Mm-hmm. Mm-hmm.
Well, not in solutions. Excuse me. Yeah, solutions, in patient solutions, it's strictly related to what people are doing to relieve their side effects. We do have a twin machine feature. It's on the left-hand nav again underneath HealthTree University. And you can click on twin machine and find your twins. We have a predefined search. If you click on that, it puts in your diagnosis and your type of myeloma if you have it. And you can see all the patients in the system that have that that type and that diagnosis. Or you can click on best twin match, and that'll look through your profile and pull in. You can see everything it's pulling in down here. It'll pull in everything in your profile that you have to find twins on. So in this case, there is no twin, with all these genetic changes, that's female between 49 to 53 years old and was diagnosed 7 to 9 years ago. So, you can maybe start closing out some of or reducing the filter. We probably have a really rare, well, and there's a lot of combinations here, but eventually, eventually you'll get to where we'll start finding some twins, or we can clear the search and do advanced search, and you can search on whatever specifically you're looking for. So diagnosis, you can find the exact type of myeloma, any genetic changes, and it will only show you the genetic changes that you've entered in your genetic testing page. So if you've not had genetic testing, this will be empty. You can search on gender and living or deceased. You can search on years with myeloma and put in a range of, years with myeloma of 4 to 18 years. You can also put in an age range there, and do some searching to try to find your twin. We will be adding soon into this advanced filter treatments. So you'll be able to search on treatments people have had, as well as all these features that I've showed you. And it'll bring up these twins. You can click on it. You can see what treatments they've had, if they worked or not, what their side effects were, and if they had genetic testing, you'd see that down here as well. And so you can find
And
a
Todd, you can also
twin.
message them in that profile that you had open. You can anonymously message them, and I think that would be a good place where you could perhaps say, hey, I'm on Revlimid and had this side effect. Did you ever have anything like that? So yeah, there is a way to connect to somebody that has similar MM markers as you that way.
Right. Yep. That's how you do it with the twin machine rather than the patient solution. So put in the filters of what you're looking for and see what twins it comes up with. And like I said, the years, you may have to, do some editing there if it doesn't find anything, and change the years or some of the different, different types or whatever. But you can search around and find twins. And then, yeah, thanks, Audrey. Great suggestion is when you click and look at their treatments and genetic testing. Again, this is anonymous. You don't know, there's no personal information displayed here as far as like address, names, phone numbers, any of that sort of information. You're just a number, you're an ID there, a number ID, but you can message that twin, and they have to accept. They'll get an email if you click create friend request, and they have to accept it, and then you can begin chatting. The little chat features up here, where you can chat. You can begin chatting conversations with your twins. So hopefully that can help you connect with someone that's similar to you, and you can learn that way from each other as well.
Great. We have a couple more. Anna, do you want to take those? Or Patty?
Sorry, I was muted. Yeah, of course.
No, it's okay.
So Marianne is asking, if I had given my consent for HealthTree to get my medical records, will the oncologist routinely send lab results, etc., to HealthTree, or do I have to remind his office each time? So this is a one-time thing, Marianne. We do it once for the first time. This one might take longer because it's all your information, and then we revalidate your profile every year. So the year later, we request again just the newest information and we add it to your profile. But if you would like us to update your labs, or if you had a treatment and you would like us to add that for you, you can contact us and we can request that information and add it for you. The easiest way for us to have your information updated is if you give consent to your patient portal, because there we don't have to like send the consent, wait for the records to come to us and then add it. We'll just log in and get that information and put it into your HealthTree profile. And right now, per request, we can add your monthly labs. So once a month, we'll go to your patient portal, get your monthly labs and add them to your profile. We are being able to do it right now. I don't know if in the future we'll have the capacity to do it for everyone, but right now we can do it for you. I don't know if that answers your question or if you have any other questions.
I also went ahead and checked into the admin, and Marianne has given access to the patient portal. So Marianne, just make sure that your username and password is correct, that they are actually working, and per request, as Anna said, we can keep updating your information, and it would be much more easily than if we had to request for the paper records each time we needed to update it. So that's great.
Audrey, you're muted.
There we go. I couldn't tell. It's sometimes hard. Thanks for your patience. Thank you guys again for Todd and Patty for being here and answering questions and going through HealthTree Cure Hub features, especially the discovering the patient solutions. That was, again, so exciting. I'm just so excited to be able to share that with my myeloma community. That being said, we did questions. Our next Connect with the Myeloma Crowd event will be on April 21st, 2021, and we will be discussing the Myeloma Coach Program. If you have felt lonely in your myeloma journey, or you simply want to be connected with someone who is going through the same experience as you, come learn about what it means to be coached. If you would like to share your experience and mentor somebody else, come learn how to sign up to be a coach and what that entails. We hope to see you there. You might be interested in our upcoming events that we have in the Myeloma Community Program. Thursday, March 18th, which is tomorrow at 1 p.m. Eastern, is our newly diagnosed myeloma patients event, and that's going to be exploring stem cell transplants. Barb Hansen, she's a myeloma journey partner, which is a different program that we're collaborating with this time around, is going to share her experience with her stem cell transplant. So if you have one scheduled and you are nervous about it or have questions, if you are not sure whether or not the stem cell transplant is right for you, please come to that event and we will be able to talk it out there. Saturday, March 20th at 12 p.m. Eastern is our Myeloma Crowd Roundtable. The topic will be what's next, decision-making for relapsed or refractory myeloma. And then on Wednesday, March 24th at 1 p.m. Eastern is our Selenexor Support Group chapter. And we're going to be talking about how XPOVIO works in your body. That's exciting because it's a very new way of targeting the myeloma. And so it puts a lot of hope into the myeloma treatment field. Thank you again to our sponsors, AbbVie, Bristol Myers Squibb, Amgen Oncology, Genentech, Karyopharm Therapeutics, Oncopeptides, Adaptive Biotechnologies, and Takeda Oncology. And thank you so much for being here today and helping us build a strong myeloma community. We appreciate each of you, and we hope you have a great rest of your day. Thank you.